Thank you for joining us. So we're here to talk about battling health supervillains, and I figure we cannot talk about supervillains until we talk about superheroes first. So who is your favorite superhero?
You want to start?
Please.
Okay. Well, my favorite superhero would be Quailman, his alter ego, or the real life person, Doug Funny. So if you're from the 90s, then you would know who that is.
Nice. And Mark, what about your favorite superhero?
My superhero is Roger Ramjet. I only found out after I grew up that the humor was really for adults, but I loved it as a kid too, so he's perfect.
Personally, I'm going to go with Spider-Man. He's a New Yorker, chemist, as well as can, sling web and fly. Pretty great. Plus the whole great responsibility thing, I feel like, is really appropriate for 140. So what is the health supervillain that you are battling? Who are you being a superhero for?
I'm being a superhero for girls and women in leadership positions, especially where health decisions need to be made.
Great. And what's the issue
Well, the issue is gender inequality in leadership positions everywhere where it exists around the world.
Absolutely. All right. And Alicia, how about you?
Awesome. Well, the organization I work with, DoSomething.org, we get young people involved in all kinds of causes. So any kind of health-related issue. I think the one that I've helped battle would be teen pregnancy. We know the U.S. has the highest rate of the U.S. has the highest teen pregnancy rate for any industrialized nation. About 1 in 3 girls will become pregnant before they're 20. So what we're working on is how can we get teens involved in actually addressing that issue themselves, using the things that they use the most, which would be their cell phones.
Yeah, absolutely. Great. And to me, my big health supervillain is childhood obesity. In this country, it's just skyrocketed. Since 1990, we had maybe 1 in 10 kids with obesity issues, and now we're seeing 1 in 3 just 20 years later. And this is leading to higher healthcare costs, heart disease, et cetera. And as CEO of TAG, we're building a physical device, an activity tracker, to help encourage more physical activity. So I'm curious about the solutions that you're working on to confront this issue of women's empowerment.
For the last 4.5 years, I've been working with the Girl Scouts National Headquarters Office in New York City. And the Girl Scout mission is stated as discover, connect, and take action. That's what girls do. And it's that take action part that we are really trying to inspire through the use of technology. So we have been piloting recently some technology that anchors learning, makes sure that the girls are really mastering the information that they need in order to step up into leadership positions and make decisions for themselves. But then the take action part, they actually have to step away from the device or take the device with them as they go to their community and put into action what it is they've learned.
That's great. I think the Girl Scouts have kind of defined action in this country, so it's really exciting to see them go digital and bring those lessons into that world.
Absolutely.
Yeah, that's awesome. I was actually a Girl Scout for 12 years of my life, so that's cool to see how they're moving into this new technology space. Would you like to
Nice, yeah, and you're working with kids right now as well.
Yeah, so like I was saying before, Do Something, we try to engage young people to take social action on causes they care about. That one issue that I was talking about before, teen pregnancy, a lot of times we've seen people trying to engage teens by telling them how their life will change 5 years from now. But at Do Something, we know that's not the best way to engage teens. The best way is to show them how their daily lives may change. So we've decided to use that tool, their cell phone, to engage with them and connect with them. I actually text over 1 million people, over 1 million young people every week to give them new ways to take action straight from their phone. With teen pregnancy, what we did is we created this SMS experience where they would have a phone baby sent to their phone that would text them throughout the day, so they could see how life actually would change if they had a baby. You know, at 3 p.m. when you're going home to hang out with your friends after school, you wouldn't be able to do that because you have a baby that you have to take care of. And we've actually seen teens interacting with that and sharing that with their friends, starting that conversation about teen pregnancy. And we know when teens have those conversations, they're less likely to engage in sexual activity and help reduce that teen birth rate. So instead of going through institutions like schools that aren't offering sex ed, or parents who might not know how to talk to their kids, teens can now talk about the issue themselves and with each other.
Yeah, I learned about it when I was talking to Nancy Lublin, and she asked if she could impregnate my phone. And I said, I'm terrified by what that means. And then she said, no, this is a tool for learning, and kids are learning about the experience by having a kid for the day in their phone. And I thought it was so great to have that really transform the digital experience, because text messaging is so personal.
Exactly.
It's different.
And we've been finding ways to talk about other health-related issues too, whether it's about heart disease. We just started a campaign called I Heart Dad to get teens to take their dads to get their blood pressure checked. Because we also know teens have the power to not just solve their own health issues, but health issues for their parents. Men don't go to the doctor as often as women do. And when their daughter, their son say, hey, I want you to go to the doctor, their dad will then go do that. So that's actually a fun campaign. And they can do it right on their phones too by submitting their dad's blood pressure numbers and sending back a picture. And we can let them know what those numbers actually mean and send them back tips on how to keep their dads healthy or other important men in their life.
That's great. I think it's so much about being accessible and taking things that have historically worked with, Girl Scouts and badges, and with, talking directly to the kids to figure out new solutions, because the schools aren't playing the role as much. We're seeing stats where I think 70% of kids now have access to a cell phone, and 30% have access to gym every day.
Right.
Right. It's completely flip-flopped. And so, how do we take lessons from the past and kind of bring them into a digital future? What I'm really interested in for childhood obesity is figuring out, can we take the health, the food pyramid from yore and transform it into a healthy action pyramid, so that we're showing kids, here are the activities that you're doing throughout the day, and connecting that to better health, so that you can really start to signify, if you're having a healthy, balanced diet, this is also what a healthy, balanced day looks like. And I think that wearables are really kind of the future of making that super accessible.
I think that's a tremendously interesting idea. I'd be interested to hear more about how that gets activated, if you're able to describe it. How does the wearable get activated with the information for the new action pyramid?
Well, I think part of it is just creating games. Like, we're starting to see city bikes all over the city here. But it's one closed ecosystem, right? Can you open that up so that kids are, and just everyday New Yorkers are taking something like that and adding gaming layers on top of it, so that you can really start to have races and start to understand trends from the data that's being produced, and how does that otherwise become more accessible, so that you're seeing it from your phone as an afterthought, or on your computer as an afterthought, but it's driving new, healthier activity.
Right. And when you create it like a game, you're essentially creating learned behavior, creating behavior change through a fun game experience.
Exactly. And Girl Scouts has kind of written the book about this.
We have a Girl Scout Research Institute that's got the most amazing material. A lot of it's published online at girlscouts.org that talks about healthy living and what girls' thinking about healthy living is. And even with the idea of gamification, one of the things we always have to be cognizant of is, if you think about a game in terms of competition, girls are going to think differently about that than boys do. So one game does not necessarily fit all audiences. We want to find the kinds of games that would work for everybody, but probably some gender-specific games as well.
Great. And how can people follow along with your work and learn more?
Well, my work is currently, I've stepped away from the Girl Scouts. I've taken a lot of the learning from there, and I've moved on to an organization called CIO3. We're at www.cio3.org. We're trying to help other organizations that need to move fast into the cloud capability with learning tools, game tools, and other tools.
Great. And how about we do something?
Yeah,
how can we get our phones pregnant?
You can text BABY to 38383. Be prepared to be woken up at 6:30 tomorrow morning and have a baby text you all day.
All right, exciting. And I would love to get more involvement and more of a conversation going around this activity pyramid. So feel free to go to markbelinsky.com and follow me, and let's get the conversation going.
Awesome.
Thanks, Mark.
Thank you guys for joining me up here.
Thank you.
Thank you all.